Become emergency 911 with the address of the emergency. I need emergency! My husband is dying! My husband is dying! Come 911 to me now, please! My baby's not breathing! Okay, now, are you with him right now? He's not breathing at all! We all are with him! Oh, please, just somebody, he's dead!
It's the AEMT lecture series. Mike Morris here. Sorry, my voice is kind of scratchy. A little allergy stuff going on, but other than that, I'm good. I know the first two chapters have been pretty rough. I'm trying to make it up to you in chapter 3, which you would assume would be the worst, probably, out of monotonous, boring type stuff, but no. We're going to get there. I think this is going to be really enjoyable, at least for most of you. The title of this is going to be called System Gone Bad. It's the David Rosenbaum tragedy involving DC Fire. I don't know if any of you guys know about this. You may not. But this occurred in 2006, and you may remember Chief Rubin, the Atlanta Fire Department chief for Atlanta Fire. So it was shortly after, this had happened already, and Chief Rubin, when he took over, this was one of the things that he had to deal with. So it goes really good with not just medical legal, but it shows an example of what it's like getting your AEMT, being an advanced provider, and seeing through a real life case what some of your responsibilities mean, and when you do not act on those responsibilities, what could happen. So let's see what we got going on here. Next slide. This is David Rosenbaum. David Rosenbaum was a reporter for the New York Times. He had dinner at home and had went out for a run. And during this run, he was mugged, and he, unfortunately, dies from a result of an undiscovered closed head injury. And we're going to talk about this call, and we're going to kind of dissect it, and we're going to see from others' mistakes what we can do different so that this doesn't happen to us. All right, so let's look at the components of what we're dealing with. We're dealing with DC Fire Department, specifically Engine 20. They're dispatched to a man down, okay, at 21:30, and they get there rather quickly 5 minutes later at 21:35. Their crew, they're riding 4 deep. The AOIC firefighter, he does not hold not a single medical license. He's been with the department for 24 years, and if it's not bad enough, his CPR card had been expired for over 2 years. Firefighter number 1 is licensed as a EMT. He has 14 years with the department, and he is filling in at that station from Station 9. The officer for Engine 20 had called out sick that day, and so his driver was riding seat. Firefighter number 2 is licensed as an advanced EMT. He's been with the department for 4 years. He's currently been assigned at that station, Station 20, for about 1.5 years. He's a relief driver, and he is assigned to drive in Engine 20 on this date. And firefighter number 3, he's licensed as an EMT. He's been with the department for 15 years. I'm sorry. He's been at the department for 15 years, but he's currently been assigned at Station 20 for 4 years. I've read about this case, and I'm going to tell you what I'm going to present you today is not all of it. We would be on this video for a long time, but I'm going to tell you just from what I read about him, this is the firefighter who knows it all. And you'll see what I mean the deeper we get into this. This might be a long video. Go ahead, get you a cup of coffee, get you something to drink, maybe something to snack on. Just kind of sit back and soak it all in. Pretty good video here. All right, so the scene. All right, so this is Grammarly Street in Washington, D.C. And it looks like a really nice area. From what I can read about it, this is like the new area, the urban renewal area in 7's immediate, down by the golf course, East Lake. It's, a beautiful area in this, and it's kind of set up like that too. That's just what I read about it. I'm not from there, and I've never been there, for the record. All right, let's see what else we got. Okay, so this call comes in at 2100 hours, around that time. It's 26 degrees, winds blowing at 12 miles per hour, and it's a clear night, and it's without precipitation. Comes into, it's not mentioned, but the good thing about, when you're reading a report like this from my end, or your end, we can put what it's like, put it together, because we know at 26 degrees with the wind blowing at 12 miles per hour, it was cold. There is no doubt. And this call occurred on the outside, in the elements. So even though it's not snowing or whatever, it's still cold. And so we have to be prepared for that. So let me just get you straight to this, to kind of fill you in before we go further. This was the Attorney General, the AIG report from this mishap. It's cited at the end of this presentation. So in case, you want to look it up, you want to read about it some more, you can. All right, so let's get a general impression. We have a 64 years of age male. He's lying on the sidewalk, described as squirming, and appears to be vomiting. He's nonverbal, however moaning. The scene lighting is poor, and there is a smell of ETOH coming from the patient. So, that's a typical call for us. I mean, let's just be honest. I mean, if I've run one, I've ran a million, just like this. On arrival at the patient is placed in a sitting position. All right, so what they did was he was squirming around on the ground like he was vomiting. And so what they did was they set him up, right? And they let him just kind of fall back and just rest on, one of the firefighters' legs. I picture maybe they're in turnout gear, and the guys just kind of lean back against them. His airway appears to be clear, and I'm guessing they're determining by the moaning sounds coming from the patient, because they do mention, the patient's vomiting. All right, so breathing is determined to be adequate. Circulation is also determined to be adequate. All right, so treatment. So the guy ends up, I think I might have missed a slide here. No, maybe not. Because I may not put it in, but he ends up having it's described by, the different firefighters in their interviews that we'll cover in a minute. But, you know, it sounds like he had some type of laceration, and it looks like they're trying to kind of hide it a little bit about how bad the wound to the head is, because, you know, he ends up dying from a closed head injury, and I think they're trying to play it off like they didn't know he had a head injury type deal. But 4x4 gauze for a head wound. This is very interesting when we get a little bit further into it. They have the patient on an O2 non-rebreather mask, which the patient keeps knocking off. He keeps, slapping the mask off his face, and there's an answer for that as well. The acting officer in charge requests an ETA on the transport unit. He's advised that a BLS unit was responding, so they have dispatched a BLS ambulance. I'm not going to go into all the stuff they did because, again, trying to keep the video time down as much as I can. But wow, some of the stuff, wow. You just have to read about it, or if you like it, want to cover it, like I said, you can go over and check it out. All right, so let's talk about the neighbors. So neighbor number one states, I heard the firefighters say 9 of 10 times it's alcohol related. Okay, so they're finding this guy. It appears that he has an altered mental status, and they're chalking it up to it being alcohol related because they smell ETOH. Mr. Rosenbaum, the wife, stated that he had a couple glasses of wine before he went out for his evening jog. Neighbor number two, very interesting comment from them. She says that she saw the firefighters, EMTs, give the patient oxygen, okay, and that seemed to make him vomit. She saw him vomit twice, and the firefighter EMTs wiped the vomit from his mouth with what looked like a Kleenex, which ends up being, just 4x4 unsterile gauze, bulk gauze. They kept trying to sit him up, and at the same time they were tapping on his chest, and they were, from what I can read in the reports, doing sternum rubs to assess his LOC. And according to neighbor number two, the firefighter EMTs did not appear to know what they were doing. And she explained that they were not cohesive and were just standing around not doing anything specific other than giving the patient oxygen and waiting for the ambulance. We've all been there. Don't lie. You have a patient that you feel like is a non-priority patient, and you're waiting on the ambulance. Now, I hope that we would have done a better assessment. We already, we have to kind of focus in. Even though we smell ETOH, we have somebody with altered mental status, and yes, ETOH can make you altered, give you that, but we have to treat that differently. We have to, because of what could happen. And this is what could happen when you don't treat it a little more seriously than some of your other calls. This is what happens. So let's look at it some more. All right, so we're going to go into the interview questions and responses. So so what ends up happening is EMS gets there. They're like, "What do you got?" And they're like, "Hey, we got an ETOH patient." And they're like, "Okay, let me have them." Now, DC Fire-EMS is integrated. This is a DC Fire-EMS ambulance. It's basic. And they pick the patient up and they transport to the hospital. And when they come into the hospital, of course, a triage nurse says, "What do you have?" And I'm sure it is a busy, busy place, just like all of our hospitals are. And the response is an ETOH. So this being a lower acuity type incident gets a lower acuity type area of the hospital. And so, all right, take them to wherever and put them in the hall. And so they do this. And after they dropped them off, they go back doing their thing. And a couple hours later, excuse me, a couple hours later, the patient's discovered to appear to be seizing. He is then rushed to a trauma room where, a closed head injury is discovered. And, they worked him, they did everything they could, but ultimately he died. Okay, so that's where we're at. And so now we've got the Attorney General's office is looking into this call because Mr. Rosenbaum was a prominent New York Times reporter. He was a somebody. Okay, and good for him. And so this is being looked at. Okay, this is being looked at, and it's a shame it should be anybody that was being looked at, but we know how that goes, and that's okay. But I want you to look. I want you to I'm going to read this stuff out to you, of course, but I want you to think about how this sounds. So, firefighter, the AYC, when asked about the crew he was supervising and their level of certification, one of his crew members, reminding you now, one of his crew members is an AEMT. Okay? One of them is. His response, no one was an EMT advanced. And the investigators know that he's an EMT advanced. They know everything about them. They know all about their levels of training. And they were like, how do you know this? And he goes, well, because their name tags would have showed their status. Now, I know what he's talking about. He's talking about the accountability tags. He's been a driver forever and a day. And one of the first things you do as a driver, right, you go in and you take the accountability tags, off the Velcro, wherever you guys at your station keep them, and you put them on the engine on the officer's side. And at one point in time in the cab, ours were color-coded. If you were a paramedic, it was blue. Everybody else, it was black. Okay, so I guarantee you that's where he's coming up with this. So, words of advice to you guys who are AOIC out there. Know who you have with you. Don't just guess at their level of certification. Know what their level of certification is. Okay, so firefighter number 1, they're going to ask him, what are firefighter EMTs required to do when they arrive in an emergency? Fair question. And so he comes up with all we are supposed to do. All we're supposed to do is take vital signs and stabilize until the transport comes. And they're like, okay, well, let's get some more from it. So when asked what stabilizing efforts might mean, okay, and what they would mean in a situation for a person down, the response is, there's a long list of stuff that we do. I don't know. So there's a long list of stuff, but he doesn't know. And that should have been his first answer. I don't know. But he continues. He then says that the firefighter EMTs could do everything except push drugs. And you've heard that a million times, right? Firefighter EMTs also stated that firefighter EMTs could radio communications. And they can tell radio, hey, this patient's more critical, send us a ALS ambulance. That's what he's talking about, right? But he's not done. He's got to keep digging the grave here a little bit. He says that, so we can up the response. And so they said, well, since this man had no medical alert bracelet identifying him as a diabetic, we didn't consider him to be a diabetic. Wow. And more wow. So here we got a guy who he obviously doesn't know what. And so we should have gotten that from our last chapter 2, right? So he obviously doesn't know what the scope of practice is for his level of certification. So, point number 2, know exactly what your scope of practice is. You're going to have a medical license that's going to be issued by the state of Georgia. And they're going to say, here it is. you are a AEMT. Please, for the love of everything that's holy, know what you are allowed to do. Okay? Know exactly what you can do. Know what you can do as an EMT. All right? Because that's when you need to try to explain something to somebody, you need to sound like you have a little bit of common sense here. And this guy is just, because, you know, they're trying to get a level of competency of what you're like. And if you're ever in this situation and you sound like this, it's going to be bad. All right, we're going to keep going. Next slide over here. So let's go to firefighter number 2, who is the AEMT. I think he's driving today. He's the fill-in, I think, for Station 9. Okay. So it's his turn in the hot seat. And these are just some of the things. I didn't take all of it. These are just bits and pieces that I thought, my God. There's more, oh my God, moments in the report. He's asked, hey, did you check the guy's pupils? You know, did you? Did you look at them? And he goes, yeah, I did with my streamlight. So streamlights, I don't know about you guys, but, you know, streamlights, they're not designed to check pupillary response. Okay, that's not what they're for. So if you don't have anything to check pupils with in your bag, get something. But if you don't have something, just simply say, we didn't have a pin line, I'm sorry. You know, I glanced at his pupils without shining a light, and it seemed to be like this. But you know, we're not. You know, that's just, it's not going to work. Okay, so then they're like, okay, well, what'd you find? And he says, well, the pupils were constricted, meaning small, and not reacting to light. Okay, so the people doing the interview, these guys are pretty sharp. Okay, so there's not just one person here. We have several people doing this interview, with people from the Office of the Attorney General, and they have paramedics, EMTs. All right, they've got their head on straight. Okay, so they recognize this is a symptom. It's going to require some further assessment, because if your pupils are constricted and they're not reacting, that's a clear-cut sign that, you know, of a neurological injury. Clear cut. And so here we are, and so they want to follow up on that. So they ask if he was sure of the pupil response. So he's going to change his statement, and I'm going to tell you why he's going to change his statement. He's changing his statement because these firefighters have a story and a script that they are trying to stick to. So 2 points in this. Don't check pupils with a flashlight other than a pen light. And don't think for 1 minute. I don't care how tight your crew is. If you get into a situation like this, do not lie. Do not come up with some story that y'all are all going to try to stick to, because they're smarter than you and they're smarter than me. And they're going to get to the bottom of it. They do it for a living. This is what they love doing. They like to get to the bottom. They like to find out who's lying, and they're good at it. So yeah, so he changes his statement. Said, well, you know, I really didn't mean that. I meant the pupils did react, and they contracted, meaning they became smaller when exposed to light. So he repeats himself. He tries to change his story, but he doesn't. He says that he changed his statement. So, well, the patient's pupils did react. Okay. All right. And then, so he's all over the place. All right. Next slide. All right, here we go. Firefighter number 3. Now, this guy is a tool, let me tell you. He is. Well, he is. You ever work with somebody who's, I got to be bigger and better than everybody here, and I got to let everybody know it too. Well, this who this is. This is one of them. He's firefighter number 3. All right. This is him describing the patient's level of consciousness. All right, the patient was looking at me sarcastically. Now we're talking about describing a level of consciousness. The patient was looking at me sarcastically, and he never said anything. I could smell the alcohol reeking from him like it was coming out of his pores. I tried talking with him, but he didn't speak. I told him we were going to take his blood pressure, but he was not really complying. Wow. Pure wow. Okay, look. I mean, I don't care if you, even if you, and now he's dead. Mr. Rosenbaum's dead at this point, so it's not like this firefighter 3 doesn't know that. He knows that. He already knows that the guy that died from a head injury. All right, so that's already known. So, why would you describe somebody's level of consciousness as they're looking at me sarcastically? I mean, you could say he was looking at me with a with a frown on his face. He was looking at me, as if he was hurting or something like that. But sarcasm being related to medical LOC, I don't get it. Okay, it's when you go into I didn't put it in the slideshow, but the neighbors never smelled alcohol. So I don't know where and he's the only one that said that the patient was reeking of alcohol. So I don't know. All right, so let's continue. And this is the part that you need to pay special attention to. Maybe it's not this part. I'll let you know. We'll get to it. I think it's next slide, but all of it's important. Firefighter EMT tried to. All right, so the firefighter EMTs tried to give the patient oxygen at 25 liters per minute, but the patient took the mask off. That's why. All right, the guy's has an oxygen jet in his face. Firefighter EMT 3 stated that the patient kept rolling his eyes at me. Well, yeah. He probably, his eyes were drying out. Firefighter EMT 3 stated that the patient was not combative and was okay after I turned down the oxygen. Okay, well, that's good. He probably did feel better. Now remember, he's not verbal. He has not been a single bit verbal in this. He's moaning, but he's not verbal. All right, he let the oxygen mask stay on a little longer, meaning he let it stay on a little longer. He wasn't hitting at it as much. And he states that the only thing notable about the patient's condition was he didn't respond verbally or follow commands, which, what else do you need? What else do you need? All right, so firefighter number 3, this is when it starts getting good. This is when you start figuring out what you got here. States that I took the lead. All right, but mostly I had firefighter EMT number 2, which is the advanced EMT, doing most of the stuff. Even though firefighter EMT 2 is a higher level by training, because he's an EMT advanced, I always take the lead because I've been on the job longer. Bam. Okay. So really, we can respect everyone's rank structure here in the fire department and seniority, and still have a higher medical license and do it without hurting feelings. One, a good AOIC wants that highest level of trained person being there. You can say calling the shots. I don't care how you want to say it. But what I would do would be like, hey, Cap, I'm going to intubate this guy. Or, hey, Cap, I'm going to do this. Hey, Cap, I'm going to do that. Right? I would keep whoever I reported to in the loop. That's like, it's crazy. It's just because you're a higher level, you can still respect a rank structure on the scene as being in command. I don't, I've had captains who were EMTs who did who reviewed my PCRs, and I didn't mind it, not one bit, because you don't necessarily have to be a paramedic to review a PCR as long as you understand what you're reading. And if you got some good ideas for me, bring them. Why would I not want anybody's good idea, regardless of that? But at the same time, if you're an AOIC, you got to have your highest level of provider at the head of that patient, caring for that patient. Got to. And you have to be the one, since you're going to be the highest level of trained, you have to call the shots. Okay, you can't be intimidated by this guy right here. All right. Firefighter EMT number 3 states, I never write down vitals. How hard is it to remember them? I give it to them, the ambulance crew, orally. So there was a thing too where there was a disagreement in the report. All right, the ambulance crew said that they didn't get a set of vitals at all. And then, of course, we got 4 firefighters given 3 different stories, anything from 1 set of vitals to 3 sets of vitals. So my guess is 0 sets of vitals, if I had to guess, just from looking at the care that's been rendered so far and looking at the looking at how these questions are being answered. I'm not seeing any level of professionalism at all. So I've got, we're going to cover next chapter. This is going to add on to it, but I think you'll be able to take the definitions from the next chapter now and start understanding a little bit about what it's talking about. All right, so now we're going to answer the questions, because the Attorney General, they have these questions that want to be answered by I believe it's the mayor of DC. So this is what they want to know. Did FEMS employees follow all applicable rules, policies, protocols, and procedures? So it says the FEMS protocol requires that all fire personnel have a current CPR certification. Guess what? So does ours. This firefighter advises that his CPR certification has not been current for 2 years. Despite his expired CPR certification and the fact that he was not an EMT, the firefighter was in charge of the crew. So this is coming from a civilian perspective. They're looking at it, saying, hey, if you're on an EMS call, then why is this guy not the highest level of trained provider? And there's arguments either way. I'm not going to get in that argument. I'm just telling you that's what came out of the report. EMTs with the highest level of pre-hospital training was not in charge. Okay, so it says the firefighter and EMT with the highest level of pre-hospital training, which would have been firefighter EMT number 2, didn't take charge of the patient care during the Gramercy Street call as required by the protocol. And you can bet our protocol says the same thing. It says the same exact thing. So you have to understand what your protocols say. So that's the other tidbit of information I have for you out of this call. You better know your protocols. You better know all of them. We have a patient assessment protocol. It tells you how the assessment of the patient should be conducted. And when you document it, you better document it to the point to where people can look at it and go back, a third party can say, yeah, their writing here suggests that they did this. All right, did they follow all applicable rules, policies, protocols, and procedures? So we're going to talk about that. Oxygen delivery, contrary to the protocol. So this is where they get given 25 liters per minute. All right, did they properly assess the patient? Absolutely not. And they're going to bust them hard here. All right, so they perceived alcohol intoxication. The perceived alcohol intoxication dictated firefighter EMT actions, and it did. It did. They could not obtain the EMTs. They could not obtain a health history. from the patient. All right. They say they smelled the alcohol, and they assumed that since the patient's altered mental status was solely caused by intoxication, they never once considered, anything else other than that. All right. They didn't do a D-stick. They didn't check for diabetes. They didn't check for hypoglycemic. All right. They didn't do any seizure questions. That none of that's there. All right. So they also disregarded the possibility of head trauma. All right, because they found blood on the back of the guy's head. Okay, and as soon as you do, what do you think? What are you supposed to think? Okay, injury. Or injury either from, from an assault or a syncopal episode, possibly. And so, in this case, now also, they're going to gig them for not mobilizing the patient, this was a long time ago, right? Things are changing. We're not mobilizing everybody nowadays. So that's the difference now, but they never once considered it. All right, so this is where they gig them on the possible spinal cord injury. Today you may not be gigged on that right now. That's changing so much. But they certainly never once tried to, put the patient in a rescue position or anything. And if the patient was too combative to do that, that's fine. Write it in your patient care report, which their patient care report, they didn't do one. Believe it or not. They didn't do one. This was a call that they thought was a BS call. And I'll prove that to you later. But they did. They thought this was a BS call. And they said, you know what? I'm not doing a patient care report on this BS call. I'm not going to do it. So, and guess what? The EMS unit that came to transport didn't do one. Nope, they didn't do one. So you want to know why there needs to be 2 patient care reports? This is why. I know. I hate it. Dude, I get it. It's a pain in the butt. It's 2 a.m. But you need to write something down that will protect not only you, but your crew. Because if they had simply done that, irregardless of the fact of what they did on the scene, if they had wrote it down and made it look like they did more than just stand there with their thumbs up their rear end, they would have been bypassed on this and it would have went straight to the EMS crew. But neither one of them did a patient care report. If you want to be treated like professionals, if you want the community to look at you as professionals, then you have to do professional things. And that means documenting what you did and protecting yourself. All right, did the first responders properly? Oh yeah, we're still answering this question. I'm sorry. So diabetes discounted due to the absence of a medical ID bracelet. Thank you. I think it's firefighter number, I don't know now, 2 or 3, who says this. Well, since he didn't have a bracelet on, we didn't think he was a diabetic. Yep. So what? Yeah, and at the end of the day, he wasn't a diabetic. He died from a closed head injury. Get it? But what's that say about them? What's it say about their thinking process? What does it say about their critical thinking process? What does it say about how they treat stuff? This is how they investigate you. And we talked to, they're going to do some things. They're going to come up here and they're going to pull your training records. That's number one. They're going to make sure that your CPR is updated, that your EMT research's been done. They're going to make sure, everything on our end's been, any type of training that we've done and documented, they're going to want it. Then they're going to find out what textbook you used in EMT school and AEMT school. And they're going to see how that's still relevant. And they're going to look at the national curriculum. And then they're going to look at the state, because the state defines how that curriculum works. So then they're gonna look at that. They're gonna pull our SOGs, and they're gonna pull the Bible. They're gonna pull the protocols, and they're gonna lay all that out. And they're gonna have some of the best, finest EMS minds in the room, and they're all gonna sit down, and they're gonna take one of those, and they're gonna look at your call, and they're gonna take the facts that they have, and they're gonna say, "Hey, look at here. All right, so no patient priority assigned." What do we, when we're, you're doing those checkoffs, right? You're doing checkoffs and until you want to throw up. When you're in the lab, you're like, is the airway open? Yeah. Is breathing rate, rhythm, and quality? Yeah. Circulation? Yeah. And you go off that, and before you move to your secondary, you go, at some point in time, you're like, hey, I'm going to go ahead and assign this patient as critical. And we go, okay, great. Or we go, you missed it. And then you get all mad. Oh, I didn't believe I missed it. I said it. Didn't I say it? And we go, no, you didn't say it. And sometimes there's an argument, right? And inside I'm laughing. Outside I'm acting serious, but inside I'm laughing. Because I'm thinking, at least when they pull their training records and they see that I was their instructor, I'm hoping that patient priority is something that you don't miss. Because either you're so mad because you think you said it and I said you didn't, right? Or flip it and maybe you're a little embarrassed because you didn't say it. I don't care either one. I just want you to do it because it matters. And you don't have to do it out loud. You can lead your team down the road of moving this patient rapidly to the ambulance or getting ready to move rapidly. Or, just besides that, or you can document it. Hey, we assigned this patient's high priority. All right, so here we go. Well, we're still moving here. I forgot to highlight this in red. So, faulty patient assessment here. No single firefighter EMT performed a complete patient assessment. And the guy was like, yeah, we're doing everything. Everybody's doing all this, all that. You got 4 firefighters out there. I guarantee you that whoever was riding the seat, the guy's not even an EMT. He's not doing anything besides hanging out, right? So that really got 3. You got 3 people, and they're out there and they're dancing around each other, right? They're dancing all over the place, and that is a recipe, right, for disaster. One person needs to conduct a primary assessment. Right? One person needs to conduct a secondary assessment. And that's the reason why I go like, okay, so you assume C-spine control, right? Pass that off to somebody else so you can keep going, or assign somebody to do C-spine control so that you can stay mobile. But don't ever, ever, ever pass it off. Continue with your assessment. The other thing is, somebody's got to pass off a report to the EMS unit. Somebody has to, because it's called continuity of care. If you're handing that patient off to an EMS unit, you have to give them a decent report. I don't care if they get the social security number. I don't care if they get the patient's date of birth. I don't care about any of that. All I care about is if they get a good medical history, right? What the patient called for today, what you've done so far to address that, right? Let them figure out the billing information. You figure out what's going to kill them, because that's what we do. But yeah, so that obviously did not happen in this case. So and document that. I always do this. I always put verbal report given to EMS Medic 58. Right? I always document that I gave a verbal report. So when something like this happens and everybody's lying, well, my report, they're probably going to assume it's pretty truthful. I didn't know that this guy was going to die like this. So let's look at his report. All right.
suspicion of criminal attack not followed up. Okay, so yeah, that's after they found this bleeding, whatever it ends up being, whether it's an abrasion or laceration. Nobody really knows besides the autopsy, and I didn't throw that in there because they didn't really put a lot of that in the report. But once they found that, they're like, oh man, this guy got something may have happened, right? And so they never changed their mode of thinking. And at the end of the day, PD tries to blame the fire department because they're like, hey, we were standing by for fire to make sure these guys were safe. At no point in time did the fire department tell us, hey, there's signs of trauma here. This could have been a robbery. This could have been this. This could have been that. So now PD is going to come out of this smelling like a rose because they're going to blame it on us. We got a lot of crap going on already. Might as well pile it on. And that's what they did. So what does that say to you? You have to manage all of this scene. AOICs. This is something great for you to do. As a scene manager, is, hey, let me let PD know that this might be a little something more than just an ETOH call. This might be a robbery, a mugging, who knows. But you have to report all aspects of the scene. But if that had been their only problem and they had treated this patient correctly prior to that, nobody would have cared. And that's something else you got to think about. If you don't know your standard of care, if you don't understand your scope of practice, if you don't understand those words in the EMT book and what they mean, okay, then you're going to find yourself getting all of this other stuff added onto you. It's going to happen. Excuse me. And I'm kind of talking. I'm not angry at all. I love this stuff, by the way. I'm having to talk forcefully because my throat, this pollen's killing me. All right, so let's see here. Inadequate assessment performed after blood was found. Again, they're just killing them here. Nothing either, but I love this one. It's scope of EMT practice completely, totally, out there misunderstood. This guy, all of them, none of them knew what their scope of practice was. So EMT 1 gave an incomplete description of the firefighters' EMT's responsibilities as taking vitals and stabilizing the patient until the transport arrives. They can do everything but except push drugs. Well, guess what? They looked at the protocols and they found out exactly what these guys could do. Yeah, and then this is the oral communications. Back and forth again on the blood thing, where the guy had a laceration, abrasion to the back of the head. One of them might have said they thought the guy got robbed. But who knows? There are reports of anything anywhere from 3 sets of vitals to 1 set of vitals to 0 vitals. So who knows? Nobody knows the truth on that. All right, so again, no written patient care report. You better start writing reports if you haven't been. Even on the calls that you think nothing, those are the calls that get you. The calls that you think, oh, we'll never hear about this one. Yeah, you will. All right, so how many of you ever heard they can't get our journal at the station? They can. County doesn't pay for that book. There was one time, I think, when I don't know, the county said they don't pay for the books anymore. So we kept whatever book we could find for a while to keep the calls in. But anyway, they're like, they can't subpoena that. They can't get it. They can, and they will, and they did. So if anybody's told you that, they were wrong. So it says there was no written patient care report. All right. But some of the information about that Grammy Street incident was logged into the Engine Company 20 Firehouse Journal. Okay. So the OIG team, they reviewed this firehouse logbook prior to this, in the investigation, and then they went back again.
So it says prior to January 6th and it's subsequent to. Right. And what did they find? So medical related calls in the book generally had minimum detail. But isn't it weird though, this January 6th call, the call in question, appears to contain information that was added to the original entry. Okay. Similar information is not present in any entries on the days prior to January 6th, okay, or after. But there was some weird stuff that they found that was added to this particular EMS call. So why would they document one way on one day for one call, but they don't document that way for every call? All right, so this additional information included a blood pressure, had a pulse reading, and the word verbal written in a different color ink from that original entry. So they didn't even try to make it look like it was a different, they're going scribbling inside it and stuff like that with a different colored ink. Guys, you cannot change anything. Once you submit your PCR, it's gone. When you write something in the journal at the station, it's done. Forget it. It's not worth it. Let it go. You can go back and put in late entry and write to your heart's content. But when you start trying to deceive people whose job is to catch people who are liars and cheaters, you will get caught. I promise you, because there's a better liar than you out there. There's a better cheater than you out there. I promise. All right, the added entries also included the notation MPD on scene. And finally, it appeared that the sentence was changed, again with an overwritten word. Well, guys, no better than that. So here's the proof of them. This is not the exact one. This is from the same crew. And this is how they document a call that they ran for a 53-year-old. They called him drunk and stupid. So, remember when I told you? This was a behavior that was building at this station and been building at this station. And they just didn't wake up and have a bad day. Okay, this was a group of folks, right, who fell into bad habits and nobody had ever called them on their habits. And they continued and they continued and they continued until somebody who was well known died. There might have been other people that died that didn't get investigated, but when you're in the journal and you're writing stuff like the patient was drunk and stupid, that tells you that you just have no regard for it, anything. And there's a certain level of professionalism that's expected out of our career choice. There's a certain level, and I might call them drunk and stupid. I'm not saying that I'm above the holier than thou attitude. I'm not. I have done that many times. Many times I've done that. But when it comes to documenting, when it comes to doing stuff that I am paid to do, I promise you, I don't just protect myself. I protect whoever my partner is. I make sure when I'm riding a piece of fire apparatus, I do the patient care. I'm a paramedic. I do the patient care reports for the cardiac arrest and anything that has drugs pushed, because I am going to make sure that we're protected. That's why moving up to an A level isn't always just a pay raise. It's not just a pay raise. The guy here, the A, he took a major hit, and the other guys did too. But they gave it to them all. But the A was pointed out for not taking charge of the scene, and he allowed that team to end up where it ended up. It's your responsibility as an advanced EMT to make sure
that when you have a patient like this, regardless of who you're working with, that you lead your team down the road of taking care of the patient. Because at the end of the day, it's the AEMT's fault that he didn't, or she didn't, in this case it was a he, didn't stop that. And shame on them. Now, this was a long time ago. I hope that this department's better. I know that, you know, it could have been easily us. I'm not pointing out DC Fire. I mean, I'm a Chief Rubin fan. I always have been. I think he's a great guy. I've only met him once, but so that's it, guys. I'm gonna stop the video and then I'll start another video for the lecture series for the chapter. I'll attach this in the chapter 3 folder though. Take care and see you next time.